we have 59 to 60 mandates on healthcare. That is driving up our costs. And of those 59 mandates, we know there are about 4 or 5 mandates which are the most expensive part of the entire dollar that we pay for healthcare. So just visiting those 4 or 5 mandates, revisiting them, and can we, in reality, afford those luxuries in medicine, unfortunately, in this day and age, is something we have to come to reckon with. And also looking at some other components in the medical world, you know, Connecticut is on the top of the list for all the wrong reasons. You know, 32 years ago exactly, when I finished my fellowship, I could have moved to any part of this country and started my practice. I came to Connecticut because it was the right place to be 32 years ago. It was on the top of the list for the right reasons, and now it's for the wrong reasons. And my concern is that as the physicians are aging, and I'm sure you've heard this, our state, the state of Connecticut, has more than 50% of our physicians are about the age of 50, including me. And we are all slowing down in our practices. When that happens, unless we make provisions for newer physicians, making this environment of Connecticut conducive for new physicians to come, we are going to be left behind, with an aging population on the one hand, and not enough of physicians, nurses, and the entire medical staff that is necessary to take care of our aging population. We have to address medical liability. That is what's driving up some of our costs. Year after year, that is brought up, and somehow or the other, it never sees the light of day. So we have to revisit medical liability. Even look at the SustiNet bill, which was just passed by the Public Health Committee. 2 days ago on Monday, the medical liability part was removed. So when it comes to that component, it is always not addressed or conveniently removed. So those are issues to make medical coverage reasonable. We have to not only look at what can we do further in terms of mandates, but as you very appropriately said, revisit those 59 mandates that we have and how much of those do we really need on an ongoing basis, both as a physician and as a small-term employer. And as you know, 70% of physician practices are small businesses, 4 doctors. 4 doctors or practitioners are in a group together. So we all small businesses struggling to meet our payroll week after week. And we do have to change that climate.